this last year alone, about $20 million for folks. And, of course, over the last 4 years, in general, we've been able to help save $1.4 billion. But I guess my main concern is that where possible, we need to preserve and maintain state-based insurance regulation, because it helps keep rates lower and it helps give quicker remedies to people who have complaints.
One of the other accomplishments in just a short while that you've been commissioner was the $800 million surplus in the coastal insurance that helped us avert the statewide homeowners insurance crisis. Can you tell us something about that?
Sure. My number one goal whenever I was elected in 2008 was to address the ticking time bomb of coastal homeowners insurance on the coast and on the beach, and doing so in a way that was as fair than the system that there was, while also not being unfair to the rest of the state. I was able to persuade the legislature to make some changes, and through those changes, we were able to help build the surplus in the beach plan, which is the wind pool for folks who need help with coastal insurance. And that surplus was built up by another $800 million. And then also I was able to persuade the legislature to adopt a system where if we ever have another major hurricane of like Hurricane Hazel type, the kind that came around back in the 50s, the biggest one that ever hit the state, that it would make the insurance companies responsible for an additional $1 billion of recovery, even if the beach plan surplus gets wiped out. And there's some additional protective measures there too, where all of North Carolina would help hurricane-stricken areas to rebuild. If we ever have that major storm. So one other thing I'll mention too is that, and this was historic as well, in addition to that legislative change, I ordered that the insurance companies cough up another $16 million that they had inappropriately taken from the reserves that homeowners have for their insurance coverage. So every way possible, I'm fighting for consumers, I'm fighting to save folks money, and I'm fighting for you.
You know, there's been a lot of discussion about regulation, and certainly in these cases you can see where regulation works for the people and the citizens of North Carolina. Certainly there's been a decrease, like we've talked about, in overall insurance rates and a continued decrease in auto insurance. The department has been around since March 6, 1899. And 24 years, Commissioner Jim Long worked for the citizens of North Carolina. Commissioner, you were the assistant under Commissioner Long, and tell us a little bit about Jim Long.
Well, he was a fine man. He served 24 years because he earned the trust of the people of the state and the voters of the state, and he valiantly fought for consumer protection and for reasonable insurance rates. And, sometimes he'd win, sometimes he wouldn't win, but he always was fighting for all of us. And I was very blessed to be able to work with him first as the Assistant General Counsel, basically as one of his attorneys, and then particularly as Assistant Commissioner, worked at side by side with him. And I think that's another reason it adds to my background to give, I think, consumers more comfort as our insurance commissioner. You got somebody, I have never worked for an entity that is regulated by the Department of Insurance, and I think that is important that people have trust in and faith in their insurance commissioner. There are a lot of states where the insurance commissioner is somebody plucked right out of the insurance industry, and, that doesn't hurt. I mean, that doesn't hurt the insurance companies, but it certainly hurts the public when you got somebody who is a voice for the insurance industry making decisions instead of somebody like me who represents the people and independent. So, I appreciate as well, like independence, the work of our chiropractic experts and professionals and physicians. Y'all do tremendous work to provide the independent counsel and care and recuperative needs of patients. And so we're working to help people, both you and I.
Okay, Commissioner, can you hang on for a few more minutes?
Yeah.
We'll be right back. This is Dr. Nelson. We're talking to Commissioner Wayne Goodwin with the Department of Insurance. He is the commissioner, and we'll be back after these messages. Nelson & Nelson Chiropractic Centers is your first stop following a car accident. No waiting, minimal paperwork, and doctors and staff that put you first. Pick up the phone and call Nelson & Nelson Chiropractic Centers. We don't just say we care for you. We prove it in everything we do. Now, take it away, Debbie.
Nelson & Nelson Chiropractic Centers. We care for you.
Good Monday morning, Dr. Nelson at Nelson & Nelson Chiropractic Centers. Talking with Commissioner Wayne Goodwin. He is the commissioner of the Department of Health Insurance and also auto insurance, homeowners, life, bail bondsmen's, adjusters, and business entities, including all the insurance companies, are under the Department of Insurance. And Commissioner, of course, I've got to ask you about chiropractic and our role in the healthcare, the affordability of healthcare. We've discussed this before, but your position as far as the importance of chiropractic and what it can do to effectively help to lower costs. We've talked about this time and time again about how chiropractic is just a small percentage of budgets, but yet it does work to reduce the amount of surgeries. It does work to help people to avoid expensive long-term hospitalization and rehabilitation, especially with regards to low back pain. And your thoughts for our listeners.
Well, Doctor, you're exactly right. And even before I became insurance commissioner, as someone who was representing injured folks, whether in the workplace or whether due to other accidents and the like, I regularly was pleased by the chiropractic care that my clients received, and then later I see that consumers receive. Chiropractic care is a very cost-effective and provides a relief and remedy for many patients, and it's something too which I think it's so important that insurance companies recognize is that when you have care that provides relief or remedy or or could very well provide a cure in some ways by curing the pain, it's something that should be covered. And I every step of the way I've been there to help ensure that our families that rely upon chiropractic care can still have it covered by their insurance, and I would like to see there be more coverage because you provide tremendous service and value to your patients.
The old adage, that an ounce of prevention is worth its weight in gold. We see this and the impact of chronic disease on our healthcare system. Prevention is such a small amount of the budget, yet it's hardly ever mentioned when it comes to this discussion over healthcare cost. And wouldn't you agree that the amount of time vested in preventing the long-term disability, preventing disease, preventing musculoskeletal degeneration that leads to long-term disability, aren't these some of the ways that we can incorporate change and actually lower costs by providing such services?
That's correct. And when done universally, talking about all the parts of the body, whether it's musculoskeletal and what have you, if you could help determine a problem and resolve it early on, you save money, you save time, and you could very well improve the life and lifestyle of that particular patient. A lot of the concerns a lot of the impact that is having on costs right now is due to items that that could be prevented. A lot of whether it's obesity or whether it's poor posture or whether it's not eating correctly and the like, or not having musculoskeletal matters looked into and resolved early on, those do have an impact on the cost. If you catch it early on, and particularly with preventive items, then it saves us all money and keeps our rates in check.
They say that the ongoing cost to Medicare and also Medicaid are the things that are really going to crush the budgets, and how Medicare and Medicaid is effectively driven in the states. But chronic disease is probably at the top of that list. Isn't that driving the cost of such programs through the roof?
Yes, it is, and that is why when we look at the grand scale of things, when you multiply the cost by the number of people who are either in Medicare or who are going to be entering the Medicare system soon, it's staggering. So, saving small amounts to us individually on the grand scheme of things is a massive amount of savings for all of us.
Well, Commissioner, we know you're busy. Before we